I'm audible and visible. Can I get a very quick thumbs up from all my dear students if my audio video is fine? And welcome in the next session of dermatology with me, Dr. Chesta Aggarwal, and today's topic is the image based questions. So welcome everyone. I'm Dr. Chesta Aggarwal, your NEET PG educator. Everyone, please give me a quick thumbs up if my audio video is fine. Can I get a quick thumbs up from all of you? Oh, very well done. So let's start with this image based sessions, and please remember on Unacademy we are starting with an integrated batch which is starting on the 25th of August. I would be requesting all my students to kindly go ahead and get your subscription. Please remember the derma classes here will be on 22nd and 23rd. So anybody interested in dermatology can join this batch. Now we are also starting with this batch which will include integrated clinical discussions with a dual educator class, MCQs and the long form case discussions, and also the in case doubt solving. This is a full-fledged live batch on the integrated concept coverage. We are also expecting a new question bank which is known as 2.0, and it is coming soon, very soon, which includes 18,000 plus brand new questions with 75% the case based questions. I request all of you to please stay tuned for the more detail and use this code to get your Unacademy subscription today. Now we also have a NEET PG Med Scholar test which is on August 21st at 9 AM. Please remember the top students from 1 to 5 rank will have 100% plus scholarship for 3 months. Rank 6 to 10 will have a 1 month 100% scholarship, and 11 to 20 and the further ranks will have subsequent 75% off, 50% off and the 25% off. So requesting everyone to please enroll now using the referral code CHESTA10. Now this is the updated price list for Plus, for Iconic, for Light and for MBBS Prof 1. So anybody interested can simply go ahead and get your subscription. For all those students who are targeting NEET PG as their exam, I think the 4-month subscription is the best subscription which they can get. They can complete their all subject discussions with an access to the MCQs, question bank and the live classes on the app. So I request everyone to please go ahead and get your subscription today. Now let us start with the image based questions or the must know questions. That is the first question of the today's class. A young boy has a itchy excoriated papules on the forehead. The exposed part of arms and legs are affected. The disease is most severe in the rainy season. It improves completely in the winter. The most likely diagnosis is anyone? Very nice. Now if you look at the image, you can see that there are some lesions on the exposed part. And the question also mentions that the lesion is only in the rainy season, but it gets improved during the winter, completely improved during the winter. So in a young patient or a young boy with the lesions on the exposed part, which is related to this season, very classical of insect bite hypersensitivity. There are many students who usually get confused with atopic dermatitis. So please remember everyone, you will not get complete remission of atopic dermatitis. You will have exacerbation, but you will never get remissions. You will have little bit of activity going on for a very long period or chronic conditions. Okay? So please remember the answer to this question is option number 1, that is insect bite hypersensitivity. The next question is on your screen. A patient of lepromatous leprosy was started on treatment. He develops ENL with fever. He reports a change in skin color after therapy has shown. What will be the likely diagnosis for this patient's condition? Anyone? Anil, Brunal, LMS, Garima, Raman. So the question gives you a history that we have a patient who was started on multi-drug therapy for leprosy, and on this multi-drug therapy he started developing the pigmentation of the skin. So the question is, which is that anti-leprosy drug which is known for causing pigmentation? Very nice. The correct answer of this question is clofazimine. Please remember, the correct answer of this is clofazimine. Clofazimine has 3 side effects. First, dryness of skin. Second, pigmentation of skin. And third, intestinal obstruction. So these are the 3 side effects which you see in the clofazimine individuals. Okay? Clear? Any confusion? Any doubt? LMS, you have any doubt? I have not understood your query. Can you rewrite what exactly you want to ask? You are asking about the IBS, whether it is related to acantholysis. I am not able to understand your question. Can you just rewrite your question? Okay, the next question is on your screen. It's a PYQ. We got this question I think in 2020 or 2019. Anyone can tell me the answer here? Now what is the question? The question says that the patient was treated with steroids for psoriasis. First of all, remember all my students, you never give systemic steroids in the patient of psoriasis. You can give topical, but you will never give systemic steroids. On stopping the treatment, he develops fever, malaise and the lesions as shown in the image. If you know, psoriasis has a very well defined erythematous, papules and plaque with silvery micaceous scale. But do you see any such appearance here? No. In this we see discrete pustules or we are seeing confluent pustules. So why these erythematous plaques are being converted to pustule? It is because the patient was kept on steroid and now the steroids are withdrawn, and when you withdraw steroids there is sudden outburst of the inflammation giving rise to acute generalized pustular psoriasis. So Abhishek and Guru, please remember the correct answer of this question is not 1, not 3, it is option number 4. Anyone with any confusion? Okay, yes. And if you see constitutional symptom like this is known as von Jumbush disease. Very nice. This is known as von Jumbush disease. Moving to the next question. All of the following infections presents with maculopapular rash except all of the following infections presents with maculopapular rash except dengue, rubella, shingles or measles. Dengue, rubella, shingles or measles. It's a very simple question and I think very easy also. It's not an image based question, but just remember that the patient of shingles or herpes zoster will never have maculopapular rash. Instead, they have grouped vesicular lesions. And these vesicles are typically located on a single dermatome. Next. Patient presents with flaccid bullous lesions involving the oral cavity and the skin. He has lesions as shown in the image below. Acantholytic cells are seen on the Zank smear. What is the most probable diagnosis? Pemphigus vulgaris, bullous pemphigoid, pemphigus foliaceus, or dermatitis herpetiformis. What is the correct answer? Very nice. Flaccid bullae means we are talking about intraepidermal split. And when you see an intraepidermal split with oral cavity lesions, this is a classical description of pemphigus vulgaris. Can you tell me what is the histopathological feature, characteristic histopathological findings? What do you see on histopath in a patient of pemphigus vulgaris? Anybody? What do you see on histopath? Very nice. You see suprabasal split and a very characteristic row of tombstone and the row of tombstone. Okay? A very characteristic suprabasal split and the row of tombstone. Is this clear to all of you? Let's move to the next part, the next image based question. A very frequently asked questions. Raman, Garima, Abhi, Anil, Abhishek, LMS. A alcoholic patient presented with the lesion as shown. He also has diarrhea. Deficiency of what is associated with this? Deficiency of what is associated with this? In alcoholic presence with the lesion as shown, he also has diarrhea. Deficiency of what associated with this? Very nice. It's a very simple example of vitamin B3 deficiency. And what is vitamin B3? It is niacin. And this condition is known as pellagra. Pellagra is characterized by 4 Ds. Can anybody tell me what are these 4 Ds? You have dermatitis, which is mainly sun-induced or photo on the exposed part, photodermatitis. What else? Other than photodermatitis, what else? Very nice. It has dementia and diarrhea associated. And what is the last one? It has, or it can lead to death. If patient is not treated, it can even lead to death. So please remember the correct answer of this question is tryptophan, because tryptophan is considered to be the precursor of niacin. So if there is tryptophan deficiency, by default you will get niacin deficiency, and niacin deficiency will present with features of pellagra. Can anybody tell me what is this rash, the characteristic rash on the neck called as? Anyone? What is this characteristic rash on the neck called as? Castle's necklace. Okay. So you have very characteristic features mainly on the sun exposed areas. Next question. This is a PYQ. I think from FMG we got the same question in FMG. Very nice. Abhi, Uma, Raman, very nice. Please remember the correct answer of this question is tubercular lymph node. This is a very classical example of tubercular ulcers, which is also known as scrofuloderma. Scrofuloderma is a multibacillary type of cutaneous TB which occurs because of local spread or extension of the lesions from the underlying infected lymph nodes. Okay? Clear with this? Next question. So very classical on the neck. Please remember the inflammation content is a little less. They are not very much inflamed. So the inflammation amount is very less in them. Which mineral deficiency can lead to the following conditions? Anyone? Which mineral deficiency can lead to the following condition? Which mineral deficiency can lead to following condition? Very nice. Please remember the mineral deficiency which leads to this is zinc. It's a very classical example of acrodermatitis enteropathica. What is the triad of acrodermatitis enteropathica? You have dermatitis, which is periorificial, around the orifices. You have alopecia, and these patients can even get diarrhea. Please remember the zinc deficiency usually starts at the time of weaning. And why it occurs at the time of weaning? Because the amount of zinc in the mother's milk can easily be absorbed, but the zinc form which is present in the top milk or the top feed is the one which is not absorbed. So because of the same reason, as soon as you shift the baby from the mother's milk to top feed, there will be presentation of these lesions. Next question. What is the correct answer of this question? Tell me what is the answer. The first line treatment for acne comedones. What is the first line treatment of acne comedone? Now please remember, we have different stages of acne or different grades of acne. Acne comedone is the grade 1. Why somebody develops acne? Why somebody develops acne? Please remember the reason why somebody develops acne is you have obstruction or hypercornification of follicular outflow. So if this is your hair follicle, like this, the hair is sitting, this is your dermoepidermal junction, and you have a gland which is present draining into the. So what happens? The sebum which is produced, the sebum, it comes out, it usually drains like this. But the step 1 is you have obstruction to the follicular outflow. And when you have obstruction to the follicular outflow, the sebum start accumulating just underneath it. And this is a comedone. So if you have to treat a comedone, what do you need to do? You simply need to give a keratolytic drug which removes that obstruction. You just need to give a keratolytic drug which remove this obstruction, and the keratolytic drug which is given among these options is option number 4. Clear with this? Any confusion? You can even give benzoyl peroxide, but please remember, benzoyl peroxide has anti-inflammatory role also. It is antibiotic role also. So you simply need something which removes that plug or obstruction, and that is why we are choosing option number 4 over option number 3. If you have some component of inflammation like a papule, then we might choose benzoyl peroxide, but not in this particular patient. Understood? Is this clear to all of you? So first line treatment for acne comedones or grade 1 acne is keratolytic drug. Keratolytic drug. The next image based question is on your computer screen. Can you tell me what is the correct answer here? Identify the condition which is shown in this image. Identify the condition which is shown in this image. Anyone? Please remember, this is an old patient. I think you can make this out with the help of the color of the hair. You can see that there is a pigmented patch with irregular surface, irregular color, and this gives you an idea that you are dealing with a patient of malignant melanoma. And what type of malignant melanoma is this? This is a very classical example of lentigo maligna. Please remember, lentigo maligna is a variety of malignant melanoma which is more common on the sun exposed areas and on the elderly individuals. Understood? Anybody with any confusion? Abhishek, I hope you have understood. You have any confusion with respect to the last question? Please let me know. Okay. So whenever you see a pigmented lesions which is present since a very long time and now or recently it has started showing some changes, then it is a patient with malignant melanoma. The next question is on your computer screen. The next question is on your computer screen. Anybody can tell me the answer? What is the correct answer? So this image is a very classical image. But this is not true, because I think this pinkish appearance which you are seeing in this particular image is because of the color effect or the camera effect. But this is showing you a very classical sign, and that is known as million ear sign. It's a very useful sign which help us differentiate the cases of erysipelas of the face from cellulitis of the face. Okay. In cellulitis of the face, the ear pinna is never involved, but the erysipelas, the ear pinna is involved. The reason is we do not have subcutaneous tissue. So obviously if there is no subcutaneous tissue, then the cellulitis lesions cannot be seen over this part. Okay, why this cannot be a nevus? Santosh Kumar, please remember, nevus usually have a uniform color. If you look at the previous question, if you look at this question, the color is non-uniform. Plus an elderly patient on the face, more towards the diagnosis of malignant melanoma. Clear? Next question, this is an FMG question. The cutaneous horn as shown in the image is associated with which of the following skin cancers? Anybody can tell me the answer here? Anyone can tell me the answer? Cutaneous horn as shown in the image is associated with which of the following skin cancer? Anyone? Very nice. Biochem classes, LMS, please remember it is not necessary that nevus should be present since birth. No, that is not true. You can get nevus in the adult age also, or it can occur at the time of adolescence also. So that is not completely true that the nevus is equals to something which is present since birth. No, that is not true. Okay, understood? Now this is a very classical example of a cutaneous horn. Please remember it is a pre-malignant condition which can convert into squamous cell carcinoma. It's a direct question from FMG. Next, again a very frequently asked, a frequent repeat question. What is the answer? Condyloma acuminata, Bowen's disease, condyloma lata or hemorrhoides. What is the correct answer for this question? Very nice. I think it's the easiest question. It's nothing but condyloma acuminata, which is genital wart. And please remember it occurs secondary to HPV 6 and 11. Human papilloma virus number 6 and 11. Patient suffering from ulcerative colitis presents with ulcers on the anterior leg as shown in the image. What will be the diagnosis? Anyone has any confusion? Garima, Ritz, Raman, Vanessa. The patient suffering from ulcerative colitis presents with ulcer on the anterior leg as shown in the image. Now if you look at this image, you have a lesion with a very characteristic bluish margin, and you can also see a past lesion which is healed with the scarring. With a background of ulcerative colitis, all these features points towards the diagnosis of pyoderma gangrenosum. All these points towards the diagnosis of pyoderma gangrenosum. Now what is pyoderma gangrenosum? It's a neutrophilic dermatosis. Neutrophilic dermatosis means the neutrophils get accumulated. The neutrophils get accumulated in the skin, and these neutrophils make the skin very hypersensitive or a pro-inflammatory area where even a mild stimulus can generate extreme sort of inflammatory response. So in these patients you develop rapidly progressing ulcers which are not treated by the sterile conditions or antibiotic. Instead we give steroids or Depson to take care of these type of ulcers. Next question. Common complication of the condition associated with this: post-streptococcal glomerulonephritis, Staphylococcal scarlet skin syndrome, encephalitis or pneumonitis. So I hope this image is a very characteristic image. You should have identified this. So what is this an image of? Very nice. Yellow colored or a honey colored crust. We have honey colored crust or a yellow color crust. This is a very classical example of non-bullous impetigo. Can anybody tell me what is another name for non-bullous impetigo? Anyone? What is the another name for non-bullous impetigo? Also known as impetigo contagiosa. And please remember, you see PSGN, post-streptococcal glomerulonephritis, as a common complication associated with this. Sometimes they do ask which is the species which causes. So it is the M49 strain which causes this. Very nice, all of you. I think this question is easy. A tourist guide in the Mount Everest, after one of his trips, developed the blisters on the feet, which is not useful for his treatment. Which is not useful for his treatment. Anybody? What is the correct answer of this question? Very nice. A tourist guide went to Mount Everest, which is a very cold environment. And during or after this trip, he presented to us with this blister. This is a very classical case of chilblain or frostbite. Because of persistent vasoconstriction, when you go in a colder environment, there is persistent vasoconstriction, and this persistent vasoconstriction can cause decreased blood supply to the areas which is only supplied by that blood vessels. And whenever there is decreased blood supply, it can give rise to pain, necrosis, and ultimately bulla development. For treating this condition, we need to give something which increases the oxygen content, which prevent the obstruction, or which causes vasodilatation. But giving phenylephrine, which is a vasoconstrictor, is not advised in this particular patient. If you give this can even exacerbate the patient's condition. So option number 3 becomes the correct answer. Okay. So with this, we are done with the today's session. Thank you all of you for this amazing session of 30 minutes. Again, I would be requesting all of you that please do attend this Med Scholar Grand Test. It's a free test. So everyone, it's a free test. You just need to put a code. The code is CHESTA10, CHESTA10. Please put this code and give the test, which is on 21st, that is on Sunday, August 21st, 9 AM. If you come under 100 students, you have amazing prizes. So requesting all of you to please go ahead and get yourself enrolled. And anybody who is interested in Unacademy subscription, kindly use my code and get your subscription today. So thank you all of you. Good day and take care.